if you're somebody that's fully vaccinated, the data really show that you are no longer a threat to others and the virus is no longer a threat to you. So I agree with the CDC guidance that masks do not really add anything for the fully vaccinated. For the unvaccinated, they have value. And I think Los Angeles County is wrong on this. I think that it's not going to really have an impact in terms of vaccinated people getting infected or vaccinated people spreading it. I think we have to give people a vision of what it means to be fully vaccinated. And what that means is that the pandemic is something that is no longer a major issue for you. And I think that's something that drove people to get vaccinated, that they could have their pre-pandemic life back. And I think that this is a step in the wrong direction. I think we need to get more vaccine into people. And we also have to stop looking just at cases. We've got to look our hospitals in crisis in a given region. And that's what should be driving public health measures, not cases, because cases are going to be there, especially with more contagious variants.
Right. So do you think that the United Kingdom is doing the right thing here, that they're approaching this the right way? Because obviously there's that debate on whether they're being risky or reasonable given their vaccination levels.
I think the United Kingdom is taking the appropriate action. You have to remember that this virus is going to be with us. We're going to have COVID-19 cases 5 years from now. The goal of the vaccination program was to remove its ability to cause serious disease, hospitalization, and death, or to put hospitals into capacity crisis. And if you vaccinated enough of your high-risk population, which I believe the UK has done, you'll see this decoupling. You'll see cases, but you won't see hospitalizations and deaths. And that's all we've been trying to do with the vaccine, tame the virus, because it's going to become an endemic respiratory virus, much like other respiratory viruses we deal with year in and year out. And I think this idea of COVID-0 or getting cases to this extremely low level is not sustainable. And I think we really have to gauge everything on hospital capacity and vaccinating high-risk individuals. And if you've succeeded there, I think that's a win when it comes to the pandemic.
Yeah, and we're looking at full vaccinations in the UK nearing 70%. Amesh, how serious a threat are the unvaccinated through mutations or the potential of the virus mutating within them for the vaccinated?
I think it's a very minimal risk. We know that this virus has been mutating since it's jumped into humans, and it's going to continue to mutate the more people it gets to infect. But it's a very high bar for a virus to be able to erase everything that a vaccine provides. Because remember, the goal of the vaccines wasn't necessarily to stop every infection. What it was meant to do was to stop the ability of the virus to cause serious disease and hospitalizations and deaths. And that's very hard for a virus to mutate around, not just because of antibodies, but because of T cells. So I don't think that there's a major risk that we're going to have a complete vaccine escape mutant. It's very rare. A lot of mutations need to happen. A lot of special things have to happen for that to occur. I think that the variants are going to continue to be there. They may become more fit, more contagious, like the Delta variant, but I highly doubt that you're going to see something that can completely, basically annihilate everything that a vaccine does, just because of the robust immunity that's been seen with the vaccines.